Today I will be performing an IV catheter placement on a right cephalic vein. The supplies I will be using are Clarahex wipes, alcohol wipes, T-port, heparin flush, and a over-the-needle 22-gauge 1-inch catheter. I will start off by flushing my catheter with the heparin flush so that I will be ready to use. And then I will have my restrainer holding the patient in a sitting restraint. Then I will have my restrainer holding the patient in a sitting restraint. After, I will shave my patient and then clean the area 3 times with my Clarahex and alcohol wipes. I will start lower on the leg to prevent the vein from collapsing. That way, I will still have the rest of the leg to use. After, I will uncap my catheter and start to place my needle. Once I see a flush in the hub, I will advance my catheter. If there's no flash in the hub, I would redirect my needle without removing it completely from the body. Also, if the catheter does not feed smoothly, I would lower my angle with the skin and then advance the entire device in and then advance the needle. Afterwards, I will remove the needle and place the male port on the catheter to prevent blood from flowing. Also, if my vein blows, I would just move on over to the other leg as well. I will then grab a thin piece of surgical tape and with the sticky side up, create 2 butterfly wings. And then I will wrap around the leg. I will then grab the notch piece and push up as close to the catheter with the sticky side down and wrap around the leg, making sure I do not cover the port. Once secure, I will remove the male port and replace it with the T-port. I will flush as well to make sure that the catheter is in. And I make sure it's in by asking the restrainer if they feel anything, any bubbling or sounds that the catheter is making. Then I will grab a thin piece of tape to wrap the T-port and prevent it from moving. I will do a crisscross shape to attach it, and also making sure that I do not bend the tube of the T-port too far. I will then grab a bigger piece of tape to wrap around the leg and secure the T-port on the outer portion of the leg. I will then finish up with a little flap so it will be easier to remove. Afterwards, I will discard of everything properly. I will then grab a thin piece of tape to wrap the T-port and prevent it from moving. I will do a crisscross shape to attach it, also making sure that I do not bend the tube of the T-port. I will then grab a bigger piece of tape and wrap my T-port on the outer portion of the leg without bending it too harshly, then applying the tape. I will finish up with a little flap so the wrap will be easier to remove for other technicians.